Pranhanda, Pau, good afternoon, everybody. Welcome to the Wales and Africa Health Links What's It Been Like for You session, which is part of this year's Wales and Africa Health Links conference, Healthful 2020. I'm Beth Kidd from Hub Cymru Africa, and I'm hosting the session. I will be handing over to Catherine Thomas, who's the chair of the Wales and Africa Health Links Network, who will chair the session as we go on. This event is in a webinar format, so that means only the panelists have got access to their mics and videos. All other attendees are muted. But if you would like to join us and talk about the work that you're doing, please put a note in the chat box, which is to the right of your screen, with the name of your organisation, and we will invite you onto screen to chat about what you're doing. If you want to send a question to anybody who's on screen, there is an Ask the Question button at the bottom of your screen. So just click on that and you'll be able to ask any of the panelists a question. And we'll also have time at the end for other questions if anything's not been addressed during the presentations. We really value your feedback on what we're doing, so I will be putting links to some feedback forms, which we'd really appreciate if you fill in and let us know what you think, and we can use that going forward, which would be great. And also to say that obviously any forms of abusive language, either in the chat box or on screen, won't be tolerated, and we will exit you swiftly from the session. But also please listen with respect and be mindful of the experience of others. So on that note, I will hand over to Catherine Thomas, who will explain how this session is going to go.
Thank you very much, Beth. This is a bit experimental because we thought we'd put something together here. I think we lost Jane already.
We have.
Well, I'll leave you to try and sort that glitch out.
Okay.
Before we've even started. So we, at the annual conferences that we've held over the last 10 or 12 years, we've always had about 100. Oh, welcome back, Jane. First glitch. So I was just saying that the annual conferences for the Wales Africa Health Links Network that we've had for, well, since 2007, we've always had about 120 people coming along. And the thing that people have always fed back as what they've enjoyed most is the networking opportunities. So clearly you can't do that if we don't have a face-to-face conference. So we thought we'd try something like this to replace it. It's all a bit experimental. Because we've been using Crowdcast for all our events for this conference, we're doing that with this as well. But we're limited to only 6 people on screen at any one time. So as Beth said, we'd really like to hear from people through this. So if you would like to join and say something, just put it in the bar. Just if you can introduce yourself anyway, and then just say you'd be happy to come on screen just to talk about your experiences with your partnership. Then Beth will bring you in, and we can let everybody have a turn if they'd like to. So, but to start with, I'd like to introduce Jane Hutt, who has been our patron for 2 years now, which is brilliant. Jane is the Deputy Minister and Chief Whip in the Welsh Government, and I've known her now for a long time. She's always been a great advocate for Wales in the world and for Wales as a global citizen. And I think that comes from your own experience, having spent a good part of your formative years in Uganda and Kenya, and you yourself are very involved in a link in Vale for Africa with a district in Uganda. So it'd be really lovely to hear about your own personal experiences, Jane, but this is quite an open discussion. So, people want to ask you questions about Welsh Government and the way that you see the Wales's place in the world. That would be lovely if people wanted to take that opportunity. So with no further ado, if I'll hand over to you, Jane.
Thank you very much. So can everyone hear me? Just to say, I'm kind of feeding back, so I'm not sure why that's happening. But is it sound very difficult?
We can hear you all right. Is it quite bad?
Okay, for you? I'll just carry on. Basically, I'm pleased to be with you. I'm a founder member of Veil for Africa, and I'm just waving my flags. Here I've gone. Right, I'm back again. Must be the internet. We've had Veil for Africa for 12 years, and it started up because I went back to Uganda in 2008. There was a big cancer conference where they were discussing work that my father did when he was professor of pathology. He was involved in the Burkitt's lymphoma research when he was head of pathology at the medical school. And we basically went to Uganda post-independence for him to train the African doctors of the future. So when I went back to Uganda, I met with a family who had actually taken my father's job, Professor Awar, and they took me to their village in Tororo and said, "What are you going to do now, Jane, for all we did for you when you lived here in Africa?" And I came back and we set up Veil for Africa with Maureen, who's the daughter of Professor Awar. So she is a trustee. She's a lecturer in law in Birmingham University, so she's part of the Ugandan diaspora. And she has linked with her organisation, her family's set up a charity in Uganda called ASET. That stands for Achieving Community Empowerment in Tororo. So we've got a charity, and it's been doing work over the last 12 years. The most key thing for Welsh and Africa Health Links is the eye care project, which every year the team has gone to work with in this rural area of Uganda, training members of village health teams to perform their own basic eye tests in Wales, and we apply sort of basic equipment. The eye team who came out are all local from the Vale and Cardiff. They're all volunteers, but they actually go out every year and do a week of eye care. If you want to look at what they do, Google Veil for Africa and you'll see a video link for 2019. They were very sad they couldn't go this year because of COVID-19. Just also to say that we work very closely with the Rotary Club in Cowbridge, who actually have provided water connections to all the local primary schools in the area. And we have supported a library in the village as well. But I just want to finally say that we've got to link all of this to Wales and Africa. You know that Eluned Morgan is the Minister for International Relations and the Welsh language. And she did develop the international strategy that was published in January. Well, of course, building on Wales and the world policies. And just to say, this links very much to the well-being of future generations legislation, where we have pledged to be a globally responsible country. And I don't know if anyone's here from Pont, but Mbali in Uganda is quite near to Tororo, relatively. And we committed to plant 15 million trees in the Mbali region of Uganda as a government. We've already got 10 million planted, and we're planting them to meet the size of Wales. So I think it's really great that we're all here together. I want to hear about some of you, the Brecon Molo link. I know Molo, I've been there. And I'm very delighted that Peter Dixon is here, who's actually just become the new chairperson for Veil for Africa. And it is about us learning together today and seeing how important this is, this time of the pandemic, which is global. It's there in Uganda. We are linking and supporting our NGO. And I just finally say, we do not do anything without the advice and guidance of our NGO in Uganda, which was there way before we started up Fail for Africa. And they keep us on the straight and narrow. Diolch yn fawr.
Thank you, Jane. Thank you. So maybe we might bring Peter in a bit later to talk about maybe the experience of the last few months and how the pandemic has affected Fail for Africa and its partnership working. I'm looking now, you mentioned Molo. I don't know whether Paul and Rachel would be willing to join on the screen, if we can bring them in with a screen and a microphone. If Beth could bring Paul and Rachel in.
I've sent them the invite now, so hopefully they will appear on screen shortly.
Okay, and I'm just looking, there's Paul Myers from Dolen, who I'm sure would like to come on screen in due course and talk about how Dolen has responded, particularly in the last few months with the impact of the pandemic, because I know Dolen has actually done quite a lot differently and risen to the challenge. And then Angela from Life for Africa Mothers. I think, Angela, you said you'd quite like to talk about the feedback from your project in Sierra Leone. So we've got a few there, Beth, who would like to share what they've been doing. So if you could send them links as well.
I have, yeah. I've invited Angela and Paul to join us.
We'll see if that works. So while we're waiting for the technology to, oh wow, look, it's worked. Welcome, Paul. Welcome, Rachel. Did we kind of bully you into showing yourselves, or are you happy to be shown? Because this is recorded, you won't be able to hide it again. Are you happy to be shown?
Yeah, that's fine.
Oh dear.
Yeah.
So, I mean, Jane mentioned, because Molo is just close to the border with Uganda, isn't it? So you
Molo is in Uganda.
Sorry, to Kenya. Sorry.
No, Molo's in Kenya. You're muddling up.
No, in another very rural area. And we've got Angela.
I think she's talking.
We've got Angela as well. Hi, Angela. Hi. Brilliant. No, Jane sounds like she's in a stadium. Angela's in her pajamas. It's working well.
Good thing I didn't with the weather. I thought, oh, should I stay in my... Sorry.
And we've got Paul. You're very welcome. So if anybody else would like to join, then just put in the bar that you'd like to join us, and we'll move people in and out. But shall we maybe start with Rachel and Paul, and how the last few months have panned out with the way that your partnership is working? Because last year, Rachel, your partner came over was it last year or the year before? The conference. The year before. No, so it's getting faster and faster. And you both of you spoke very movingly about the challenges of maintaining a long-term partnership. It made a deep impression on me. So how has the last few months impacted on your partnership?
Well, the health side is probably a little bit on hold pre-COVID anyway. So Dr. Magdalen's moved on to a position in Nakuru County, and so she's outside of Molo now. So Paul's probably done more in terms of the link, because my work within the NHS has probably precluded me from doing very much active. So Paul's probably more in touch with people in Molo than I am at this time. So Donald is the person, another member of the disability group. I don't know whether he's online as well and wants to say anything.
Rachel, he's not signed up at the moment.
Okay. So Paul's trying to delegate responsibility, but if you can't sign that, you'll have to speak. Obviously, the baseball, the volleyball had to be put on hold because they couldn't meet.
And what was done is we money to provide sanitation for the community.
So they've been out. They have managed to reuse a grant that they were offered for the volleyball to promote sanitation facilities for the community. But using the DPO, the Disabled People's Organisations, although they do have, so I should qualify it. Dr. Magdalene may have moved on, but the organisation has moved on as well, and they have a much more membership-based organisation on the ground in Mono, which Paul and Donald particularly have been liaising with. But it's probably less of a medical model and more of a community model now.
Yeah.
Although we were always very community-focused.
So that's been after we had a report back last weekend.
So last weekend they had a report back. Well, can't give you the statistics, Donald got those, but they are starting to roll out these facilities for improving sanitation and hand washing. From a disability sense, it's providing a positive image of disabled people actually. So we're still waiting for the written report, but obviously the improved technology available has helped with the communication, although we were still using it beforehand. So they need to get some more feedback before the next step in the funding of that project. So that's the state of play at the moment.
Yeah.
So it's more disability focused, but it has a positive impact, hopefully, the wider community.
Well, for myself, I don't want disability.
But he doesn't want Brecon to just be disability specific.
No, that
would defeat the whole object. But we've got a few other bits and pieces going on. The jewellery, we've got as a market restarting soon. So
which said maybe with many of the links sort of switching to things like sanitation, water sanitation and hygiene projects, because I know we did a questionnaire in April, May time of all the partnerships, not just the health partnerships, on how COVID was affecting what they were doing, and there were so many of them switched their existing funding into either sanitation, supporting soap, hand sanitizer, access to water, and then also masks, supporting people to produce masks. And then the emergency fund that Welsh Government came out with, the usual Welsh Government grant scheme for Africa, the round that was due to come out switched to an emergency COVID fund. And we didn't know whether there were going to be any applications for that because there was £160,000, but in fact there were £800,000 worth of applications for that, and so much of that was exactly what you'd be doing, either supporting livelihoods or water and sanitation. So it's kind of a theme across the way everybody was responding. So shall I move on to, because Angela, you mentioned you've got a COVID specific project that you got involved in Sierra Leone. Do you want to tell us a bit about that?
Can you hear me all right? Because I've had some problems with the sound. Can you hear me?
You're very faint, actually. I don't know if you can get a bit closer or turn up the volume.
It's up on maximum, Catherine. I don't know. Is that any better?
I think it's gonna. Can people hear Angela?
Yeah.
Yeah, just about. So keep shouting, and we'll do.
Well, I think most people know what our normal activity is, the medications and the midwives. We haven't been able to continue selling the midwives, obviously, but the supply of medications has continued, albeit that there have been some major problems with flights, cargo flights, but they are going out. But we obtained a grant from Hub Cymru Africa for Sierra Leone, led by Morlai Kamara, our representative in the country, where we targeted pregnant women in the most challenging environments, the slum areas, namely Crew Bay in Freetown, which houses 11,000 people, and also Waterloo, just outside Freetown. That project is now completed, and I asked Morlai this morning, he's in the process of doing the report, but I asked him for some comments for this afternoon. I asked him whether any of the other NGOs, the big NGOs, had done anything active. It would appear that the NGOs have given the government funds in order for the government to do the project, and ours has been the only sort of visible project. So you've got most of the NGOs here, they just gave financial support to the government. Then it's the government team that's doing the general radios and TV awareness campaigning on the COVID-19. They are not specifically targeting a group of people. They're not going out and giving donations as we did. Life for African Mothers, we are the only NGO that targeted women and old people in slum communities, marketplaces, and so in the capital city in Waterloo, with continuous awareness campaigning and donations to poor communities, the people who are in slums that are not positive. So we were targeting pregnant women, and there's people, obviously everybody knows with Africa, to get people along, you offer food, they will always come if you offer food. So we gave rice and other items, and it's been a huge success. The government, the Ministry of Health, have been aware of what we were doing and supporting us. So it's been a huge success. Alongside that, in Liberia, the British Embassy, the ambassador brought to our attention a fund that the new Department for International, the Foreign Office and Development Office had some funds available, and we've just now started a similar project in Monrovia, Liberia. We're going around targeting pregnant women and families, again in some of the large slums. So the big slum in Monrovia houses 75,000 people. So Abdul has been going in there with a team of volunteers to raise awareness of COVID. Of course, the problem is social distancing is a bit of a problem in the slums. But strangely, I'm sure you're all aware that the numbers of cases, the numbers of deaths in the countries are relatively low compared with the West. I think Sierra Leone and Liberia have got probably around 100 deaths. But immediately they had the first case in these countries, they locked down. And of course, a lot of that is that they knew what to do because of Ebola. So it became second nature to them and nobody complained, they just did it. And it seemed to have helped. But there are challenges, of course, with living in the slum areas, but they're doing extraordinarily well, given some of the circumstances and surroundings that people are living in, to have such a low number of cases. Whether that's true in Uganda as well, I don't know. But in Sierra Leone and Liberia, most certainly, we've been very pleasantly surprised and happy to hear that the cases are so low. So it's both projects, the one is completed from Hub Cymru Africa, that will get a report soon to the team. And then the one in Monrovia is partway through, and everybody's responding incredibly well to that. So we've sort of diversified, and it's been a great success. Thank you.
Thank you very much. That's quick adaptation for and using the people that you know on the ground, which is the advantage that we have, isn't it, in partnerships, that we've got existing local, strong local people, and we're just in the position to support them, and they see the priorities and they see what needs to be done, and it's supporting what they know is going to work.
Those people are like gold, really. They're amazing.
Yeah, absolutely. And it's an interesting point about we were just saying with Jane before we started that all the predictions were far higher mortality by now across all of sub-Saharan Africa, and it hasn't happened, and there's in the way that we thought it was going to happen. But some of the impacts may be more on livelihoods because of the control measures. And that might have a bigger impact on different people in the population. So women and children might be impacted because of the fallout. And then the challenge of keeping your ordinary services, your regular healthcare services going in the face of that. So the services for women, children, for NCDs in particular, those are going to be impacted and have a much bigger impact on people's health than COVID alone. That's kind of one of the emerging concerns. So anybody looking in the questions there, Peter has volunteered to come on as well. I can't see anybody else has volunteered to come on.
Okay, I will need to
invite him at some point, and then we'll throw somebody else off if someone else wants to come in.
Okay.
But does anybody want to ask Angela a question from what she's talked about there? Does it kind of ring a bell with other partnerships? So Paul, you're nodding a bit there, and maybe should we move on to yourself, Paul? And I think you're muted at the moment, Paul, but do you want to tell us a little bit about what it's been like for Dolan? Because you really have kind of changed the way you work and done things quite differently.
Yes, I think we have, and thanks for asking. And I think over the last, so Dolan Cymru, for those who are not familiar with us, we're a link between Wales and Lesotho. We've been established for quite a bit over 30 years now, and our focus has largely been around education of young people, particularly school children, and a lot of the work has revolved around exchanges of teachers. But we've also had a health section, and that again has relied on people going off and largely train the trainers, but also providing direct training to frontline workers. And I think we were becoming very well aware of our carbon footprint, and that this was very reliant on volunteers very generously giving their time and but spending some time away from families and home, etc., coming over to train, and of course using aircraft and flying to get there. So I think we were beginning to aware that we needed to change. So I think certainly the education side is certainly going through a dramatic change, but I won't talk about that because obviously this is a health conference. So I'll talk a little bit about the sort of health related stuff. And Catherine, you made reference to water and sanitation and hygiene, and that's a key area because we've had droughts in Lesotho over 2 years in the last 5. And that's beginning to be quite a good way of drawing the education and health together, because the WASH work was very much focused around the schools. Not been able to do that in COVID because the schools have shut down, and they're still shut down, I think, in many places. So not been able to work with schools, so working more with communities and people who previously worked with education now beginning to work with local health services. So I think WASH has certainly come into its own, obviously, because it's about making the best use of limited resource, water, and using the tippy taps, which some of you will be familiar with. The other bit of work that we've been involved with recently is with setting up a community sewing club. And one of the tasks that the ladies involved in are going to do is creating masks. So hence the link to COVID. So we've managed to purchase them some new sewing machines to help with their work. So that's a community project. The other piece of work which Catherine has helped facilitate is working with the Family Medicine Specialty Training Programme. So there are very few doctors in Lesotho and elsewhere, and very few family medicine. And so they've had this family medicine training program running for about 7 years now. And doctors have been going over from Wales and helping with them training once a year now for 5 years. But one of the things that we realised that they were really becoming quite stressed. I mean, they just work phenomenally hard. It makes our junior doctors' lives look a doddle, almost. They work terribly hard. They're very committed. They do far more than family practitioners do in the UK. They're often running hospitals. They're having to do public health. They're having to do work around AIDS and HIV. So we, with the COVID money that was provided by Wales Africa programme, applied for a grant, and that's doing several things. One, and perhaps most importantly in the immediate short term, was provision of PPE, because we're finding that the provision of PPE was not adequate, and our colleagues working in the district hospitals were at risk of being exposed to COVID without adequate protection. So we sent out a good deal of protection for them. And also we're providing a service for well-being for the family medicine trainees based on the programme in North Wales, and very generously donating some time from psychologists in Wales have set up, and now we're paying for them to provide a service. In addition, over the last few months, we've done online webinar for treatment of respiratory distress associated with COVID, which is something that they asked for, that they were very worried about, although I don't think they're seeing much of it. They're not seeing as much COVID as they expected in the district hospitals we just made reference to. And also they ask for some training in general surgical skills, because they're asked to do general surgery, and we provided that online. And Monday, we're starting a week's course in palliative care. So we're switching to online learning. We are learning about how to teach online. Our students at the other end are becoming more familiar receiving that. We're recognising all the problems that have been discussed on this conference and other webinars in terms of internet connections and data allowances and everything. In terms of in Wales, we've had a health group, and we used to meet in various parts around Wales and always complain where should we meet, and never agreeing, like everybody else with whole Wales responsibilities. We can never find the right place to meet. Everybody, at least 40% of people, are unhappy with any venue you choose. And so we've tried to meet online, and we've even run a small, within Dolan, mini conference, which went really quite well, and was great to see some new people who we never met before coming in and joining us, and hopefully they will stay with us. So yes, we've kept going. Clearly, it's a change for the long term, but we still feel that we can work closely with our partners. In fact, I think the other advantage from this, I think we will rely much more on our partners in country to do more than we do. So in many ways, more of the money will probably go in to providing employment for people in Lesotho than perhaps we have done in the past. So in many ways, it's working for the good. But let's hope we don't see the numbers. I think it's early to say what's going to happen with COVID, and particularly in Lesotho. It's a very rural community, so I think people are used to living 2 meters apart. And I think it's just hard to predict whether they're going to see second waves like we're beginning to see.
So yeah, you've the way that Dolan has responded has kind of highlighted, it's kind of the direction of travel that we were all trying to go in anyway, wasn't it? If you look at the power dynamics of partnerships, I mean, you mentioned that at the beginning, Jane, and that's an issue that's come up much more strongly, is about inclusion and recognizing who has the power and how they have the power, and who gets excluded and why they get excluded. So it's pushed us to think of those issues even more, hasn't it? And maybe some of this has got a silver lining, in that some of those things will become more explicit and will change. So
I think in terms of our trustee board, for example, I mean, we've been going for a long time, but we haven't had anybody from Lesotho on our trustee board. And that's something that we're now changing. And that's not without its difficulties of trying to include somebody from another country in trustee board meetings, and you know, whether that is permissible under charity regulation, etc., and can they be signature bank accounts and all sorts of things. So there's all regulation problems, but I think it's very much forcing us to think, how can we listen to the other communities over there and stop telling them what we think they need. And I've done that. I'm aware of that. You know, and listening more, and sometimes not saying, well, I don't think that's important. If it's important to you, let's hear it.
Can I
say something there?
Yes, of course.
I was just thinking that's really helpful because what we have found over the years is if you don't engage and listen, then the projects don't always work because they're not, you know, engaged. And I think we've had some experience of that because suddenly sometimes money comes along and they, oh, you must grab that, you know, you must do that. But actually, if it hasn't come from the community. And then the other thing, of course, is intergovernmental relations are really important. So if you haven't got your governmental, local or national recognizing, and, you know, through memorandum of understanding, there's quite a bit of formality is important to acknowledge the governance of another country and setting. And I think but, you know, that's really important about why we, for example, were thinking we should change the name from Wales for Africa to Wales and Africa, because it is about how we're working in partnership, and we gain so much from that relationship as individuals, as links. You know, it's very empowering for us, but we're empowering our partners.
Exactly. I'd quite like to bring Peter in now, Peter Dixon, if we're talking about that. So, Beth, you're going to have to throw one of us out. You'll have to choose.
I am. I feel like we need some sort of dramatic music. Oh, Paul seems like he's nominating himself, so I'll jettison him and bring Peter into the conversation.
You can come back shortly, Paul. So I've never managed this before. This is quite challenging, isn't it? Sorry. Angela, did you want to come in there?
No, I was volunteering to be the next one checked out if you need to.
Brilliant, thank you, Angela. That's good to know.
Peter, it's very nice to see you. You're very welcome.
Thanks very much, Catherine. And thank you, Jane, for an email this morning. I was elected, or whatever formal, as chair of Vale for Africa, which is a great privilege to do. But it was only about 3 weeks ago when we had the AGM. So I feel that I'm on a sort of very steep Eiger type learning curve. But it's been quite fascinating because I can play the new boy on the block and asks all sorts of what may appear to be daft questions, but actually help me sort of tunnel underneath what's going on and how best I can do it. James mentioned the I project, which is the flagship project, and I've just quickly looked at the statistics, and in 2019, which is the last year they were out there, they did 5 clinical days. They screened nearly 1,200 patients in those 5 days, which was an increase from the previous year had been just over 700. And out of those 1,200, they did a secondary care referral for eye pathology for about 130 patients. So it's obviously a very, very intensive, hard-working 5 days. The other thing is that the I project not only provided personnel to work there for the 5 days, but also provided equipment that we might take for granted, to help with managing and screening eye problems. And there's a very nice report on how grateful they are to have that equipment. So I think that's a lovely example of actually health and how Veil for Africa is working. There are 3 other projects, one of which the library is not specifically about health, but I would argue would actually be about promoting people and supporting things like mental health. I think that's important. And we sponsor a student at the Atlantic College, UWC. And again, the complexity of dealing with her, she's just come back, has to isolate. The mental health issues of that are quite challenging. And that's how the volunteers who support her have worked really hard. And the water project, which Cowbridge Rotary have taken on in combination. Now they've got on board a Rotary club in Germany, in Meissen. And I had a discussion with them the other day about how they feel they can keep trying to roll out the water project to provide water to schools, basically to stop children spending hours and hours walking to a water point and carrying the water back, and therefore losing a lot of education time. 3 weeks into the role, what do I see the issues? I think probably Jane just touched on it. Veil for Africa. I'm just slightly uncomfortable with that. It's the feeling of that we're actually doing it to them rather than taking them with us. And that might just be in the title, but I think that's something we've got to think really hard about, because perception of people out there is really important in promoting the charity and therefore the support for the charity. With COVID-19, our fundraising has been turned on its head. I think that's obviously experienced by lots of charities. But I was really grateful because there was a very helpful session yesterday in this conference on fundraising. So Paul, our treasurer, and myself, we actually linked into that yesterday. And actually some really good ideas came out that I think are quite important to help us move away from the sort of traditional evening when we all get together and raise funds and things like that. I think we're in a very different world. And I think we've got to look very, very carefully and be much more professional is too strong a word, but I think we've got to go out and try really hard to get the grants that are out there. Everybody else will be trying, but I think we've got to try doubly hard, because the figures just from the Eye Project show you that there is a huge and an increasing need. And I think we've got, as a charity, we've got to be really careful that we haven't created a need and then we can't fulfill that need. So, you know, those are my thoughts. Very happy to take any questions.
Can I ask you a personal question, which is, how did you get involved yourself? I mean, what brought you into?
Well, there's a certain person on screen that we've known each other for several years. I mean, my background, I was a GP and then medical director up in Yorkshire. We retired down here to be near our family and settled down. That was nearly 11 years ago now. And it's quite hard when you move from one area to another, especially at our advanced stage of settling in, because people have, you know, professional and friendships that have honed over many years. So we're just part of the community, and we got to know Jane. I sing in the same choir as Michael. I'm doing a PhD at the moment on Asian doctors. So Jane has kindly invited us over, and we've talked around that. And actually, Jane probably doesn't know this, but one of the things that I'm drawing out in my PhD about the Asian doctors who came to Wales, a lot of them have continued over here. They feel they have a debt to the country they came from, and quite have got really involved in charity work, either charities here or charities back home in India. And I suppose that those thoughts and how they were, and it's come across as a theme quite strongly in a lot of the interviews that I've done, made me think, well, yes, you know, we all live very nice, cozy lives, we're comfortable off, but there are lots of other things, and in some way, if perhaps mirroring some of the work that the Indian doctors have done, that if there's a way of supporting a charity, which I feel is important, then that's my thoughts were there. Jane didn't know anything about those thoughts, but then, you know, the email dropped into my inbox. I just wondered, you know, what else she knows about my thoughts.
It touches on an area that in the Wales for Africa Health Links network we've got interested in. I don't know whether Zed Sabanda has joined us. He's been in a few sessions now, but we were talking to Health Education and Improvement Wales, who kind of they're responsible for all the training of health and social care workers in Wales. Only been set up by merging the various bodies a couple of years ago, but they have developed a global engagement strategy that started off around international recruitment, which was not a very altruistic kind of approach. But certainly the chair and some of the key kind of people within HRW are very interested in moving on from just looking at the benefit to Wales of international recruitment to making it a two-way thing, because as you've said, pretty much all the diaspora workforce, and that's nurses and doctors who are working in the NHS in Wales, have a connection with a home community and are in some way supporting that community. I mean, like Zed and many of his colleagues, professions, they go back and do capacity building with their colleagues, so they're offering their expertise and in many different ways, as well as just the funding. So if that's, I'm really interested in what you're doing for your PhD, and maybe we could connect up when we go back and have the next conversation with HEIW about how kind of the NHS in Wales can formalise what the diaspora workforce is doing and try and support that a bit more systematically. So it's that
would be really interesting. I've done some work with HIEW. They really, it started with the Wales Deanery, because I've got lots of GP education and deanery connections, and so I'm aware of some of it, but not, you know, that would be really helpful. Thank you.
Well, let's keep in touch.
Yeah, thanks, Catherine.
Yeah.
Perhaps could I just come in and say thank you for Peter for also sharing more about what we're doing as a local charity, but to say that we've also got a trustee who is an Indian doctor, Dr. Haz Shah, and I think he probably will feature it in Peter's work. But an awful lot of the Indian diaspora, Indian doctors now, came from Uganda and Kenya. They came particularly from Amin's time. They left and some of them, a lot of them came to Cardiff. So I have there's a very Bimla Patel, who is very involved in supporting our charity, was brought up in Kampala at the same time as I was. She went to the Aga Khan school. I went to a government school in Kenya. But we're now both living in South Wales, and she actually wants to contribute, but as Peter and you've said, Catherine, back to, that's where she brought her family were. They were, they left Kampala with nothing. They got on a plane, they landed in Cardiff, and now, they've been very successful in business and charity work, big part of the Hindu community. And actually Uganda wants to engage with its diaspora, Indian diaspora, as well as African and Ugandan diaspora. This is particularly, obviously, Ugandan issue, that quite a lot of Kenyans came as well to be doctors in the South Wales Valley. So I think there's so many connections that we can make, and of course a lot of these are doctors as well as Peter's doing this wonderful research. I'm hoping it'll become a book, Peter, when it comes out. But it's a wider, it is a wider issue, and probably in other countries as well, that we can make those connections. Thank you.
Yeah. I think having those connections are really important, because these people who've come over feel a debt, and it's fascinating exploring their life stories and the migration and why, and especially through Indian partition, and they feel they have a debt that they want to pay. And I think it's justifiable for charities, that we're hearing about in this meeting, to actually plug into that in a way, because I think that would really help. I think it would help both sides. So I think the outreach work is really important.
Definitely. I know Angela wants to come in, and also Mike Greenwood has put something in the chat which would be really nice to explore. So if you're okay, if Beth sends you an invite, Mike, and then we'll invite you in. If you don't mind, Peter, can we bring Mike in instead, and then while Angela is speaking? So Angela, go on, fire away.
Just a comment about the importance of listening to our partner country and what they want. Remember, there was a great story from Lenny Henry about Comic Relief years ago. They went into a village and sunk a well because the women were having to go to the river to get water. So they sunk this amazing well, and then realized that the women were walking past the well and still going to the river. And when they were asked why, they said, well, keep in mind, in our homes, we have about 10 people. We have our in-laws, we have everybody coming in and out. When we women go to the river, it's the only time we have any time to ourselves. And so they didn't use the well. Nobody had asked them. They said, nobody asked us whether we wanted a well. So it was a lesson. It was a lesson to me in how important it is to ask the local people exactly what they want, instead of thinking that we know what they want. So it's something that has stayed in my mind the whole time. But you're welcome to check me off now, Catherine, okay?
Hey, you're all right. We've got a bit of space. We've got Mike in now, Mike Greenwood. So you made a very interesting point about the lovely YouTube video that was made in Norway, and we all had to donate to Norway. So do you want to expand on that, Mike, and tell us a little bit about your link and how things have been for you in the last few months?
Yeah, I think that link on YouTube, if you just type Africa for Norway into YouTube, you get a series of spoofs about our sort of ideas about helping other people, and they can be very condescending, like that Band-Aid thing about, do they know it's Christmas? Well, they're Coptic Christians, so they didn't, because they celebrate Christmas in January. And it's, you can be a bit sort of culturally insensitive if you're not careful with that sort of thing. And I certainly agree with that. We've been very, very careful about only doing, what people want, because in Africa you can see all sorts of abandoned equipment and old tractors and all sorts of things that people have very, raised a lot of money and donated, but they never actually get used because people can't afford they don't know how to use it, or they can't afford the fuel. And it's just not the right technology. And one of the things is, not sending things out there, but buying them, sending them money and getting them to buy stuff from a local shop, so that when they buy a printer, that they can get the cartridges for, and that people know how to fix it when it goes wrong, instead of sending them out some piece of kits which they have no idea how to use and they can't get the stuff for. And also it's supporting, so then the money, because if you get grant money and you spend it all here and take stuff out there, then all the money's going here, isn't it? And not supporting people in the local communities. And, I think one of the previous speakers did mention mental health, which is something that's very rarely mentioned, although in fact it's one of the greatest killers in the world, and certainly one of the most debilitating things is depression, suicide, serious mental illness, which is what we deal with in Zanzibar. And it is something that rather gets ignored. I'm talking about this on Monday, but the average spend per person per year in places like Zanzibar is 20 pence, as opposed to £2,000 in the UK. You know, we spend 10,000 times as much per person on mental health, and we, you know, we always think about, with health, we always think about machines that go ping and malaria and all these things, but actually, you know, mental health is the big killer. And you know what we've been doing. We've been supporting rural communities because of the problem of travelling and so on. But what we've been doing since the COVID thing is training mental health workers to work with the COVID teams to support people with mental health problems who are getting very isolated because of COVID, but also to support people with the mental health aspects of COVID, which was, you know, brought up that you know, this has very serious consequences for people. So we want the people that we work with out there to be very safe when they go out, because the Zanzibar has specific COVID teams, so we're training people with a grant from HCA, thankfully, to go out and be safe with the COVID teams, but support mental health, but provide some mental health support for people in very rural areas, because again, there's a lot of problem with not being able to travel, not being able to afford to travel, and being stuck. And also by supporting people in their local communities, it keeps them safe, because they're not having to go into Zanzibar City to get treated.
You brought up quite a lot of interesting points. We could follow a lot of those paths, I think. I'm just aware that we've only got a few minutes left here. So, you know, a lot of the points that people have made, we could turn into a big discussion by themselves. So just to say that we've still got a few more events. We haven't got any tomorrow. Rest day tomorrow, thank goodness. And then on Monday morning, there's a tech conference that goes on to Tuesday morning, and we've got several events. And you're involved in one of those, Mike. I think is it Monday afternoon?
Yeah.
Doing your session. So if you go to the Hub Cymru Africa website, there's a link at the beginning of the chat, but if you just go to Hub Cymru Africa website, you'll see the remaining events, and any that have happened already, they're all there to watch again, so people can come and watch this again if they want to immediately after this is finished. And Mike, you're doing your picture is doing all sorts of,
yes, it's weird,
quite disconcerting to see you turning green and pink.
That's actually what's happening.
That will be recorded forever now, so anybody can come back and watch that. But I'll draw things to a close here, and that's been a really interesting discussion, and really good to hear from each other. We could probably do this for a lot longer. I would like to thank Jane for your unstinting support for Wales and Africa partnerships. And your direct experience, your sort of kind of personal and direct experience is invaluable, because it does feed into government in many, many ways, I'm sure. So I really appreciate you coming out on a Saturday afternoon to join us, and everybody else as well. Thank you for joining us, and keep in touch. We're starting a mailing list. So at the bottom of your screen, there's a green bar. So this is going to be a health-specific mailing list. Everybody, we send all our messages out on the Hub Cymru Africa newsletter, but we just thought people who are specifically interested in health will do something a bit more in-depth and focused on health. So sign up for that, please do. And then, Beth, do you want to just wind up and tell us about the feedback?
Yeah, if you, as I said in the intro, we really value everybody's feedback. So if you don't mind taking a couple of minutes just to fill in the surveys, I've put the links in the chat. You should just be able to click on those and click straight through. And yeah, give us your thoughts on what you thought of today. But just to echo what everybody else has said and say thank you so much for all being part of this. And it's really great to hear about people looking at how they can be more inclusive and more representative, and you know how important being needs-led is, and how that leads to more successful and more sustainable projects. So it's really a great take-home message. So thank you very much everybody for your time, and I will end the broadcast and say Hwyl fawr.